Hi, I'm Dr. Patrick Monahan, and I'm going to just talk to you today a little bit about the anatomy of the eye. We're going to be doing some other videos, we have done some other videos on treating floaters by vitrectomy and treating floaters by YAG laser, and then we'll have some other educational videos we'll be putting on our website for Retinal Diagnostic Center as well. But today I thought I'd start with the basics so that when we're talking about things like posterior vitreous detachments, or we're talking about cataract, or we're talking about glaucoma, these kinds of things, you have an understanding of what it is, retinal detachment, retinas. So we're going to start with the eye, and I'll show you that first off, the front of the eye is called the cornea. I call it the watch glass covering of the eye. It basically protects the front of the eye. As we go inside the eye, the next thing you find is the iris, which is like the aperture for a camera. It goes up and down, lets in more or less light. Then we hit the lens. Now this is the lens. This lens is clear when you're a kid, and somewhere around age 10 it starts to yellow a little bit. It gets yellow and yellow, finally turns brown. That's the most common kind of cataract, called the nucleosclerotic cataract. And as you're well aware, this thing sits in a little baggie. They can get a whole little hole in the baggie in the front, suck the thing out, put a new plastic one if they need to, and that's cataract surgery. Okay, but these things just focus the light. What you see with is the retina, which is the whole inside lining of the eye. The retina, the information from the retina goes back through the optic nerve here, which goes back to the brain where the picture sort of developed. Now the eye is not hollow, it's made of, it's full of this clear jelly-like substance. It has little strings going through it. It's called the vitreous. Now the vitreous is solid when you're a kid, but it turns to liquid or liquefies in the very center. When it liquefies, starting about age 10, you get a bigger and bigger fluid-filled cavity. There's still a little bit of strings going through it, but it turns to almost completely to liquid, except for there's an outer shell which stays. As you get to your 50s, 60s, and 70s for most people, this shell will collapse. There's a ring around the optic nerve here called the ring of Vogt, or Weiss's ring, depending on who you want to believe named it. It pops off like an O-ring. It pops off. The fluid goes through the center of the hole, and the fluid and the jelly peels off. Now that ring is a whitish ring, and sometimes it won't go away, and that can turn into a big floater moving around in your eye. The jelly itself will usually disintegrate, but not always. Sometimes the jelly won't disintegrate, and you'll continue to have floaters in the eye. There's a very small area here called the brown part, called the pars planitis. This is an area where you constantly make fluid in the ciliary body, which is right in front of that. This is where you make fluid in the eye. It goes around the lens and out through a drain that goes 360 degrees around the front of the eye. When that drain gets clogged up and you're still making fluid, the pressure goes up. That causes something like called glaucoma, or high pressure in the eye. The high pressure can hurt the nerve and damage the nerve back here. That's what glaucoma is. So when the jelly peels off, as we talked about, it can peel off with no problems. For most people, that's the way it goes. For some people, especially if you're very nearsighted, or if you have a family history of retinal tears or detachments, the jelly, as it peels off, will stick to the retina and take a little piece of retina with it. So it grabs the retina here and tears it forward. You get this little horseshoe-shaped tear. This is like wallpaper on the back wall of the eye, and hence, when you get a tear in there, fluid that's in the jelly now is turned to liquid. It starts to get underneath that retina, and that causes a retinal detachment. So oftentimes, if you have a vitreous detachment, meaning the jelly peeled off, then and you get a little tear, we will put a little laser and arc weld around that area where the tear is to keep you from getting a retinal detachment. So that's kind of a basic of the eye, just in a nutshell. Just something so you have an understanding of what we're talking about. We'll go into a little more depth and talk about other things like the macula holes and epiretinal membranes. The macula, I should mention, by the way, is the very center of the retina. It's just this small area here. It's where most of your light focuses. It's your good reading vision. There's a very high density of rods and cones, which are at the bottom of the retina, here. That's where, so that's the most important part of the retina, actually. Okay, I think we'll wind it up there for now. There'll be other videos that you can look at that'll go in more, like I said, more in depth for some of these entities we talked about, and we'll have some videos on here about treating with vitrectomy and with the YAG laser, both work really well for floaters and opacities in the jelly. Thank you very much.